This will go off now.
Yeah. Live streaming.
Should I go?
No, it's live streaming.
Should I start? Good evening. This is Dr. Marwa. Should I start my talk? Good evening, ladies and gentlemen, and thank you organizers for inviting me for this program. I'm going to talk to you about impact of vitamin D deficiency across life stages of Indian women, strategies to overcome this public health problem. So the role of vitamin D in our health is to maintain blood calcium levels in normal range, which are vital for normal functioning of nervous system, bone growth, and achieving peak bone density. It's a potent immune modulator and prevents development of autoimmune disorders and respiratory tract infections like influenza, COVID-19. It also inhibits uncontrolled proliferation and stimulates differentiation of cells, thereby preventing common cancers like breast, colon, and liver, and also plays a role in insulin secretion under conditions of increased insulin demand and increases the insulin sensitivity. The various cutoffs which have been defined is ample to know that less than 5 nanograms per ml is severe vitamin D deficiency, 5 to 10 is moderate, 10 to 20 is mild, and 20 to 30 is insufficiency. So what are the recommended dietary allowance? Up to 1 year of age, that is infants, they need about 400 IU per day. 1 to 70 years, 600 IU of vitamin D per day, and more than 70 is 800 to 1000 IU per day. Dietary intake that achieves serum vitamin D levels of more than 20 nanograms in 97.5% of the population is what is called recommended dietary allowance. The food sources are very, very few. We have vitamin D in cod liver oil and fatty fishes like salmon, mackerel, tuna, sardines. None of those commonly consumed foods by Indians contain vitamin D. So why should we have sound bone health for which calcium and vitamin D are required? Because poor bone health is responsible for causation of almost 8.9 million fractures annually worldwide. Lifetime risk of hip, vertebral, and wrist fracture is 30 to 40%. And this is associated with very high morbidity and mortality. For instance, if you follow up 100 hip fractures over 1 year, you will find that at the end of 1 year, 20% would have died, 30% would have become permanently disabled, 40% would have been unable to walk independently, and 80% would have been unable to carry out at least one independent activity of daily living. And it has been assumed that by 2050, we'll have about 6.26 million osteoporotic hip fractures worldwide, and most of them would be in Asia, and especially postmenopausal osteoporotic fractures. This slide itself tells you that higher the vitamin D levels in your blood, lesser are the health problems, lesser is the frequency of common cancers, osteoporosis, fractures, heart attacks, hypertension, low birth weight, etc. So vitamin D has an important role, and this is just to give you a glimpse of the role of vitamin D in extraskeletal systems. This is a case of congenital ichthyosis with fish-like scales over the face, edema, eversion of eyelid, inflammation, and giving high dose in 7 days results in such normalization of these scales and edema. These are another cases showing fish-like scales on the legs, which improve over a period of time when you give them high dose followed by maintenance dose. And this is a paper that was published by us on vitamin D, a new promising therapy for congenital ichthyosis. So is vitamin D deficiency a major public health issue? Well, we did study starting with pregnant women, and we had about 540 pregnant women in 3 different trimesters, and the mean serum level were less than 10 nanogram, that is moderately deficient, and vitamin D levels were deficient in 96.3% of these pregnant women in all 3 trimesters. But the important thing to note is that there was a strong positive correlation in mother-infant pairs, meaning thereby if mother had low vitamin D, so would be the vitamin D in infant. Coming to lactating mothers and their exclusively breastfed infants 2 to 24 weeks old, we evaluated 180 lactating mothers and showed that 93.8% of these lactating mothers had low vitamin D, and so did the infants. 91% of infants 2 to 24 weeks old also have low vitamin D. 40% of these infants had clinical features of vitamin D deficiency. And it was also seen that infants born to mother with low vitamin D have 4 times higher risk of developing moderate to severe vitamin D when compared to those who had higher levels. So what are the adverse effects of vitamin D deficiency in pregnant mothers? Well, they can have osteomalacia, they can have preeclampsia and preterm deliveries in pregnancy. As far as infants are concerned, newborns with low birth weight, low bone mass, they have poor or delayed growth, rickets in utero or rickets at birth, tetany, which is called spasms, neonatal hypocalcemic seizures or convulsions, and abnormal enamel formation and dental caries. Just because of vitamin D deficiency, you have so many of these problems. Coming to children, we had done this landmark study in American Journal of Clinical Nutrition, where we evaluated 3,000 children for vitamin D, and we found that nearly 10 to 11 healthy girls from both low socio and upper socio had clinical evidence of vitamin D in terms of bow legs or knock knee, and the vitamin D levels were significantly lower in girls than boys. And the adverse effects that you see in children is poor growth velocity, rickets, short stature, bow legs, knock knee, and frequent respiratory viral tract infections. This is a picture of rickets showing bowing of legs sideways and short stature. Coming to adults, well, we did evaluate pregnant women, nurses, and physicians at All India Institute in Delhi, and also soldiers. If you see here, all these groups had low vitamin D, both in summer and winter, but the Jawans had reasonably good vitamin D, achieving almost near normalcy. Study at Lucknow, Kashmir Valley, Tirupati, and Delhi rural areas all showed low vitamin D deficiency, and the females had significantly lower vitamin D levels as compared to males in both rural as well as urban regions. And this is a study of Indian health professionals across the country. And if you see these circles, the red portion gives you the prevalence of low vitamin D levels. So in all the states, vitamin D deficiency was very, very high to the tune of 60 to 90%. Coming to elderly people, 50 years and above, we evaluated nearly 400 elderly people, and we again saw that the vitamin D levels were just 9.7 nanograms, that was moderately severe deficiency, and the prevalence, biochemical prevalence of vitamin D deficiency was in 92% of the subjects. And usually in elderly, they complain of muscle aches and pains, osteomalacia, osteoporosis, hip, spine, forearm, and other fractures, and increased prevalence of autoimmune disorders or cardiovascular disorders, skin disorders, cancer, etc. So the conclusion was that recent epidemiological studies from across the country clearly reveals a very high prevalence of vitamin D deficiency in Indians of all age groups and both genders, but especially more so in women than men. And the adverse effects also were seen more commonly in women than men. It's a major public health problem which needs urgent attention. So what are the adverse effects of chronic deficiency of calcium, vitamin D deficiency, poor nutrition, physical activity on your musculoskeletal health of Indian women? And we did this study where we evaluated bone mineral density in girls and boys from upper socio and low socioeconomic group. And you can clearly see that girls from upper socio had significantly higher BMD than those from low socio, and similarly for boys. And boys on the whole had significantly higher BMD than the girls. Coming to Indian females using DEXA studies, when we evaluated bone mineral density and compared it to Caucasian women, the study from Nehans and Hologic study, we see that the BMD at hip, forearm, and lumbar spine in females, the BMD at all the three sides was significantly higher than the BMD in Indian females at all the three sides. Coming to elderly people, we evaluated nearly 1,600 healthy normal males and females. There were 808 females in different age groups from 50 to onwards. And we found that the prevalence of osteoporosis was to the tune of 35.1% in normal healthy elderly people. And in females, this prevalence was 42.5% as against 24% in males. So this is the kind of difference that we have in the prevalence of osteoporosis. And when we evaluated radiological vertebral fractures in elderly Indian men and women, which we called as Delhi vertebral osteoporosis study, these are all healthy women, we found that the prevalence of fractures, vertebral fractures, early vertebral fractures range from 14.7 to 22.4% in different age groups. These are all healthy females who had early morphometric fractures. So that is the kind of an impact that you have on the BMD when you have low intake of calcium and vitamin D. Coming to lean mass studies, again, the Indian females, as compared to Caucasians, had low lean mass, both at total leg lean mass, arm lean mass. And we concluded in the study that Indian women had 15 to 28% lower lean mass when compared with their white Caucasian counterpart from the Nahan study. So what is the impact of this lifestyle, sports training, nutrition on bone mineral density and the lean mass? We evaluated sports girls representing Delhi University or the state as compared to control girls. So BMD at femur, femur neck, radius, lumbar spine at all the sites was significantly higher in sports girls as compared to controlled sedentary girls. And similarly, the lean mass in the sports girls was significantly higher at all sites as compared to sedentary normal control medical students. So how do we overcome this vitamin D deficiency? Either you consume foods rich in vitamin D, or you expose yourself to sunlight, or you take supplementation, or you consume foods fortified with vitamin D. Now, the first study that we did was to evaluate, do we get adequate amount of vitamin D through our diets? And we concluded that in absence of vitamin D fortification of foods, diet alone appears to provide you very, very little vitamin D, almost negligible. So therefore, the foods rich in vitamin D basically are very, very few. And Indians, being vegetarian by nature, do not consume those foods, as I mentioned, fatty fishes and liver, etc. Coming to sunlight, well, we have three questions which come to your mind. What is the best time for sun exposure to synthesize maximum vitamin D? What percentage of body surface area should be exposed? And what should be the duration in winter as well as summer? So we undertook this study to evaluate ultraviolet B irradiation in different parts of the country, which are required for synthesizing vitamin D. And if you see this slide, in all the three seasons, it is between 11 and 1. You have the maximum peaks, whether in winter or monsoon or summer. So the best time to expose yourself to the sun is between 11 and 1, and most of us do sit in our office during that time. Then what is the impact of this UV radiation on vitamin D synthesis in children? We did expose these children between 11 and 1 for half an hour every day for a month. And what we noticed was that there was an